Pascal P.PRINCE, a cardiac surgeon in the P.T.Salpêtrière Hospital.
And I'm Alan Coombs. I'm an intensivist also in the Institut de Cardiologie at Le Pitié Hospital in Paris.
So we built up this meeting on ECMO and short-term support about, it was 3 years ago now, because we really thought there was a need to have people to talk all together, and not only surgeon or intensivists, but surgeon, intensivists, cardiologists, nurses, perfusionists, all these people involved in the management and the care of patients with cardiogenic shock and respiratory heart failure. Why we did that also is that because in La Pitié, so we have this huge program on ECMO, this huge ECMO program, which started more than 10 years ago now, and every year in our institution, those are more than 300 people supported for the lungs or for the circulation with an ECMO. So this is why we really thought that it was our responsibility to set up this meeting and get all the people to talk together.
2 years ago when we decided to launch this first ECMO meeting in Paris, and actually it was a great success because there is many members of the teams caring for patients who have acute cardiogenic shock or acute respiratory failure. We need to have updates on the the big studies and the literature, but also on the practical way of treating those people. We have both cardiogenic shock and severe respiratory failure, and so we'll move in the coming years to practical session, both theoretical and practical sessions of the care of these patients who have severe cardiac and respiratory dysfunction. The other very important point, and this was the first year, this year we got a course of cannulation for those patients who have severe shock and respiratory failure. And it was a great success. It was done in the École de Chirurgie in Paris. Maybe Pascal, you can tell us a little bit about that.
Yeah, that was a great part. In fact, we were so we had a few students with us. There were 9. So this is a very selective course, and it was amazing the progress we had during the day. We started at 9 and ended at 9 a.m. and started at 3 p.m. in fact, and the whole day we had the lunch after that. The whole day the students really learned how to cannulate. It was on goats, and to cannulate the goats, fem with a surgical cut down first, and then we went for percutaneous cannulation using regular cannulas and also the balloon cannula for respiratory support. And then we also did some intrathoracic cannulation, and we had the opportunity to play also with the ECMO circuit to show what was happening if the animal was too dry or too full, and there was a kinking and so on. So that was a very, very interesting experience, and we will renew that next year, of course, and we'll try to even have more students to do that. So this was a new point this year, and next year we will try also to extend the program to nurses. But maybe Alan can tell a few words about that.
First of all, we save the dates, and you also have to save the dates. It's going to be in 2013 on Thursday the 20th and Friday the 21st. And we will have the course on Wednesday. It was going to be the 19th next year. Will be also on a special registration with a limited number of students. And for the international course here in Paris on Thursday and Friday, 20th and 21st, we'll have also lots of hands-on session, and especially for nurses and also all the people who are working like perfusionists, also in these medical and surgical teams, and we will have dedicated sessions for nurses and perfusionists, and it will also be in English, but we will have a translation next year from English to French in all of these sessions. So I think it's going to be a good opportunity for all of the members of the team working in these medical surgical centers to come here in Paris to have updates and hands-on session on both the care of patients with cardiac failure and respiratory failure.
Yeah, and you just have to remember that this course is on ECMO, but not only on ECMO. This is on ECMO and short-term support devices, and not for the lungs, because we don't have too many systems for short-term support for the lungs, but for cardiac support, we have more and more short-term support devices, which are very interesting, and will not compete, but are complete the use of ECMO. So this is really part of the meeting, having this presentation of experience of different centers with short-term support devices.